Welcome. Today is our 326th Zoom session. For the last 325 days, continuously we are conducting this Zoom session. Many of our participants know what is IFPH. Even though, let me introduce what is IFPH for those who are attending our meeting newly. So, International Forum for Promoting Homeopathy is a organization formed with the intention of promoting homeopathy all over the world. It's a non-religious and non-political organization formed with the interest of homeopathic lovers. So this is not only the organization of homeopathic doctors. We have homeopathic lovers also in this organization. So we are conducting seminars, and many other doctors are coming here and sharing their views and ideas to benefit each other. So our only aim is to promote homeopathy all over the world and unite all the homeopathic doctors together in one platform. So we are successfully continuing our journey, and thank you for the doctors and participants, those who are coming here and encouraging us for our success. So today's our guest is Dr. Sadhath Sait. So he is graduated from Father Muller's Homeopathic College, Mangalore, and he is the state committee member and unit secretary of IHK and the chief editor of Kudumba Doctor magazine. And he is taking awareness classes for the treatment of alcoholism for public. Now he is working as a senior consultant in Dr. Sait Homeopathy, Kochi. Thank you, doctor, and welcome. Dr. Sadhath Sait, you can unmute and talk now. Welcome, sir.
Thank you, IFPH.
And your time is up to 9:15. Thank you, doctor.
9:15, okay. And thank you so much for giving me this platform. It's an international platform. The way you have been doing and conducting things in a, it's something, is it audible?
Yes, sir, yes.
Okay, conducting things in a much better way to spread homeopathy all over the world. So we all know it was a COVID condition. COVID was going on, and the situation in Kerala was also not different. But Kerala faced a different scenario altogether. It was a scenario that homeopaths were not even allowed to even treat homeopathy, not even allowed to even utter the word COVID. The scenario started in last March 2021, and the issues went on like this one. In between, we got the news that okay, arsenic alb can be given as a preventive, as an immunobooster, not even preventive or genus epidemic. It was considered just as an immunobooster. If you want to give, you can give that as an immunobooster. Not even you can even utter the word COVID or immunity or COVID preventive. So that was the state, and we have got even a circular from the health secretary stating that if you treat COVID, you will be jailed. That was a situation which was going on in Kerala. And from there only we had to do something. We have fought in the Supreme Court. We went into the Supreme Court. We got partial here and there judicial involvement. Lot of things happened, and the journey went on, and it has reached now. Till now, even today's 13,000 and up. So I got some opportunity, or I was lucky or unlucky or whatever you can call it as, but I got an opportunity to treat few, maybe around 750 odd or 1,000, in between 750 and 1,000 COVID patients. And it is about my experience. So please know, this is just my experiences. How did I handle cases? First few months of COVID, we used to put it on the Facebook, only homeopathy can do it, and homeopathy can do it, and homeopathy can do it. We have been doing it from long time, and slowly patients started believing in us. Slowly patients started coming to us. And we started giving medicines. First phase was that phase or first episode or whatever we call it as, we were getting only few cases of we were getting patients of less uh, severe cases. It was just like a viral fever. When the things went on and the second stage came, and before that also, it was showing lot of signs of the COVID getting worse into worse. So let me start explaining how I handled it, or how I went on doing things according for the patients or the very severe. I'm not talking about the COVID, which was on the first stage. It was just mild or asymptomatic or something like that, because everyone has been doing it. What I got an opportunity was to treat to the worst cases who were in ICU and ventilator, and a lot of other things, with oxygen, without oxygen, a lot of cases, and pneumonia, everything. So that is what I'm going to share it here. So can I, Alicia? Okay. Okay. Can you see all the
Yeah, yeah.
screen?
Yes, sir.
Okay. Okay. First few slides are just like on a COVID structure of the COVID virus, which is not too significant for the doctors. Okay. So this is something which we will start the clinic. We will start the workers. I'm just going to tell you something which I faced as a risk factor. Risk factors of the COVID. What we have seen in the risk factors. We have been telling that whether the homeopathy will act or no, whether the homeopathy has medicines or no, whether can we do anything here. First stage, okay, homeopathy was thinking that, okay, we could do something. Second stage, we didn't know what to do. The risk factors which I came across in the clinic, or COVID patients, or phone or anything else, the first one is older adults. That was a first of fear stuff. People will be telling that older people are at risk. So avoid over people or protect over older people. That was something which was told and which was spread. So older patients, older adults were very, very, very risky. Then long-standing systemic and health and social inequities, means a lot of health issues, older patients, diabetes, a lot of cases. Then came the cancer, heart conditions, old, new, whatever the heart conditions, COPD, hypertension, cardiomyopathies, everything came under a big risk issues. Chronic kidney issues, then type 1, type 2, overweight and obesity cases, pregnancy cases was considered one of the very difficult to handle, because we don't know what was the study going on, what will happen in the pregnant woman, whether the kid will be there or no, whether the baby with the fetus will survive, whether it will go in for a pregnant abortion or stillbirth. We don't know. Smoking was another. This one, stroke or cerebrovascular disease, that was another issue. So the main issue we faced was 90% of the Kerala, or 50%, 50 or 60% had that something or the other thing with the lungs, either an allergy or a COPD or a asthma or some cystic fibrosis. A lot of things were going on. So this was one of the risky cases which we have gone through. Then HIV, Down syndrome, that was coming to the sides, but mainly it was a chronic cases, lung diseases, COPD, all those creating a havoc in the, more than a havoc, it was considered, or it was been discussed as one of the biggest risks, and these people have to be taken care. So this was something which even bothered me, because can you take it? Can we take the case? Because there was no one to guide me, no one was to help me, because if at all we talk to them, they say we don't know, or we have partial knowledge about all this. So a lot of things were going on, and as a doctor, or as a general practitioner, or as a homeopathic doctor, majority of the investigations done, or investigation was heard also for the first time, or we have been hearing it for this, maybe very less we have been hearing it. And COVID gave us large spectrum of investigations. So I was also a part of it, and I also didn't know what to do, how to tackle this kind of cases. And patients used to just give us only on the WhatsApp or on the call. They used to say, my D dimer is this, my CPR is this, CRP is this, my troponin is this, that is this, X-ray, CT scan, everything was going crazy. So what I had to do is, I had only option left out to us. Two things I faced was, in severe cases, what I could do is, I have to rely on the lab reports, because symptoms were not clear. Either the patient was in the isolation, so patient was not able to give you. Patient was in ICU, or patient was ventilated, or patient was isolated in the room with severe complaints. So nothing can be done. I can't do anything. Even if the taking cases, I don't get symptoms. Bystanders, they used to give me symptoms, but it was reliable, not reliable, nothing. So only thing I was reliable with me was lab investigations. Lab investigations, what we have seen is complete blood test. The first and foremost blood test they used to send me is complete blood test. So I have to depend on this for the prescription. So if I ask for some symptom, they will tell me, okay, they have a thirst. Oh, so doctor, I don't know. Oh, doctor, he takes little. Someone will tell me after 1 hour, half an hour, 1 hour, they will call me and say, doctor, he is not taking water. So all was confusion, because anxiety of the patient, bystander, everything was creating havoc. So I had to rely only on the lab investigation and to the severe cases. The first and foremost thing I have gone through is complete blood count. Complete blood count, what we used to see is cytopenia, leukocytopenia, lymphopenia, everything is less, and thrombocytopenia. Thrombocytopenia plus increased ESR. That was something which I have faced and I have seen in the first thing. So complete blood, how did it help me in complete blood test, and how did it help me in prescription is, leukocytopenia is a major or a major sign and symptom, or symptoms expressing a viral problem. So that was not the first thing. And with leukocytopenia, it came a thrombocytopenia. When the thrombocytopenia comes in with the complete blood test, my prescription will go into two medicines, was phosphorus and this one, X-ray. These are the two medicines which has helped me looking at these symptoms. Plus, if I get symptoms, I used to prescribe. So these are the two medicines. Thrombocytopenia, if I get, phosphorus is there, and X-ray is there. So next to us, another symptom which was making people scare was, oh, CRP is high. People doesn't know that CRP is common with any infection or any inflammation or anything, but the people were making them scared. Okay, your CRP is high, you have to get admitted, or CRP is this, you have to get admitted. CRP is just an indication of what is going on. That's it. So I have not given so much importance to the CRP, because CRP was never bothered me, because CRP will be high, that is expected. So it has never bothered me what to do. Then came the test was LFT, liver function test. Liver function test was also seen in was taken in the this one, what I call, was given more important in the treatment of COVID. Most of the cases, most of the physicians used to do. So these people used to send me, okay, I am taking that doctor, or see, Kerala, what was happening is, either they will be in the house or they will be in the hospital. They will take all the reports and send that to me. Or in this one, there is an online consultation, or the ASHA workers used to go and tell them and give the medicines. So then they will give the list of blood tests to be done. So when they go for the blood test, they will send the report to me. That was happening, and over the phone, everything, every 5 minutes we used to get one on the reports. So it was creating a havoc. So liver function test, AST, transferase, everything used to go high, because LDH, there are a lot of things was going on. So it was basically I will come to the why the LFT was high, because liver was a center point for indication of all the other problems. So liver function test, if I get this, I used to give, I will liver function test was high. So the medicine and another lab test was creating hangama was D-dimer. D-dimer was creating a lot of havoc. D-dimer, if it goes more than 500, automatically they will ask them to admit. So patients were in a confusion. If it becomes 600, they will call them for admission, or 700, they'll call them for the admission. So what to be done? That was my confusion. So we had to master all this, because we have to handle patients and reduce their anxiety. It was more of an anxiety. If the D-dimer goes little high, panic calls used to come. So we should tell them what is D-dimer, how it is helping them, how can we do it, what is the significance of D-dimer. Everything we used to explain first. Then we stopped explaining D-dimer. If it is little high, don't worry, you take this, you take that, you take this, and it used to come and help us in a better way. I will explain with the medicines what medicine we used to give for this, what medicines we used to give it for the others. So serum creatine, creatine kinase. This was another one. This was not used very frequently. D-dimer and the LDH and other things. That was giving, and troponin. Troponin was another one which used to be taken very seriously and was given more importance in the treatment of COVID. So creatine kinase was not giving it, and it is seen in the, because it's a viral inflammation, influenza, all that, because that way they used to just give it creatine kinase. Troponin used to say that, okay, if it is lungs damaged, they just wanted to check whether the heart is also involved. So first marker is troponin. They used to send the troponin first. So most of the cases, when the severity is high, or when the CT score is more than 10, troponin could have gone up. That's a part of it. That's we can take note. Do this, you get this, or take one, get one free. So troponin was another one. Then the another inflammation which I have been seeing is severe infection caused by cytokine mediated LDH, lactate dehydrogenase. This was giving me a lot of havoc. This was one of the, this also was giving me, because all the cases will have a body pain, severe body pain. Whenever you see a body pain cases, LDH is always high. So that was another one, which was because body pain was one reason people used to scare and go to the hospital or COVID centers. Plus the D-dimer high. So this is the something which used to, and ferritin. If you see ferritin little high, then the patient most probably goes from my hand or our hand or homeopathic hand. So they said cytokinin phenomena, that this people used to discuss cytokine, and one patient used to send to me, that same patient used to send it to 10 people. Some patients used to send the cases to allopathy doctors whom they know, or family doctors. So every way they have been bombarded with the more than a COVID, they used to get feedback from hundreds and thousands of people. So ferritin has a direct influence on the cytokine problem, inflammatory effects. And when the ferritin is high, most probably patients say that, oh, you're going to die, or you're going to have this, you're going to have that. So that has created another one. Another one is X-rays. I've been mentioned X-ray. To be honest, I have seen X-rays of very few patients. Very few patients, because I don't know why these physicians, or why these people were not taking X-rays. Majority of the people were not taking X-rays because they relied on mostly on the CT. So whenever we see the CT scans, we were not, as a general physician, CT scan become too popular or too used stuff on this COVID times. But CT was giving me a lot of this one, because CT score 5, you have to admit. Your CT score 7, you have to go in for antibiotics. CT score 8, 9, you have to undergo steroid. 10, 11, then there's nothing. They give whatever the medicines in the world. God only knows. Can you hear?
Yes, yes.
Okay, so this was something which was really creating hangamas in my this one. What to do, we didn't know. So last, we had to rely on the medicine part of it, and on basis of thrombocytopenia or the lab reports. These are the medicines which it helped me most probably in these conditions. Complete blood test, thrombocytopenia, phosphorus 30, thrombocytopenia, I used to tell you, it is X-ray 30, phosphorus 30, ESR elevated, ESR elevated cases. The medicine used to give us Aziod 30, and at cases tuberculum 1 was given. That too, in very, very few cases, tuberculum had to give in Aziod 30. And don't ask me how did I give it. Classical homeopathy, so I don't know whoever it is will disagree with me, but I didn't have any experience, or I started with zero experiences. So my case was, it was only 90% of the cases I have not seen it has come from the phone calls. So what I used to do is tell you, buy all this for 10 medicines, keep it with you, give it as per my instructions. So 10 medicines, 12 medicines used to be there in their home. I think few might have seen the videos which one patient kept it in his videos, saying that these are the medicines which was given it to me. So every time those medicines were not given, LFT, when LFT is high, I used to give Calmec, picric acid, chelidonium, and chionandus. At times, mixed it, given it single by single. Calmec and picric acid together. ESR high, Aziod been added. Thrombocytopenia, phosphorus is added. Phosphorus is one of the best medicine. It has helped me. If you ask me, 750 odd cases, phosphorus and bryonia are the two medicines which I have completely relied on. 100% relied on was phosphorus and bryonia. But the difference is, phosphorus was given 30 every half an hourly, 1 hourly, 2 hourly, 3. I don't know. I have given it. Nothing has happened. It has helped me like miracle. I can tell you, it has helped me like anything. Bryonia, I used to give it only by tinctures. 30 and 1 200 was very rare prescriptions. Tincture 10 drops every 1 hourly, 2 hourly. That was my prescription. And D-dimer. D-dimer is something which has done a miracle of it. Phosphorus has helped me like anything. Crotalus horridus is another gem of a medicine which we have it in homeopathic medica. Anything 5,000 to 3,000 D-dimer in one day. I have the records with me. 5,000 D-dimer in one patient. It has come to 3,000 just in a one day only with phosphorus. Crotalus horridus was added. Troponin. When the troponin was high, I used to give adrenaline, cactus, and crataegus. First few cases of very severe cases, we used to give everything together. Then slowly we learned the confidence. We gained the confidence, then reduced to one medicine, two medicine, depending upon the more the troponin, more the frequency, and more the repetition. Crataegus, cactus was the major medicines was given. Adrenaline was given once, maybe in a few cases. LDH was high. Lactate dehydrogenase. Lactate dehydrogenase used to give us a lot of body pain. Body pain, it is called severe body pain. That was the only thing we used to get only body pain. We cannot ask the patient where exactly is the body, whole body, backbone, back, or any part of the body. Nothing could be elucidated. So this was the medicines which helped me. Natrum salicylicum 30, that is one of the best medicine for all the body pain of corona. Sarcolactic acid, if you ask me how many patients I might have given for 100 patients, more than that. Phosphorus 30, no counts. Macrotin 30, my senior Dr. Chandrabanu has helped me. Macrotin 30 used to be given only for the patient if he tells that I have got a back pain of the lower back pain. Macrotin 30, in one cases with coccydynia, 1 or 2 cases of coccydynia was given cobaltum met, and back pain also cobaltum met has been given. Then Epitorium, Gelsemium, Belladonna, Rustox, Stenum, and Bryonia. Bryonia used to be there. So these are the medicines repeated every 1 hourly. You can tell me, why did you give it? I cannot explain why did I do that, because first of all, as a doctor, I was never what are called sure of what was the symptom, how was the patient. If I ask the patient and bystanders in 1 minute, they will change the symptoms in another minute. So nothing could be asked, nothing could be elicited, nothing could be given. So my prescription was only on the WhatsApp, whatever the medicines coming. And I was also scared about the circular. If one case or anything goes wrong, I don't know what could have been the consequences of it, because Kerala was facing the tough problem from the IMA and other even the ministers. They were not giving any facilities for us to treat. So this was the trial and error, or you can tell that we have learned it. Ferritin, bryonia, phosphorus, creatine kinase, bryonia tincture, and epitorium. So this was the medicines which X-ray and CT scan. If you ask me which one helped me more is CT scan. CT scan, we used to tell that, okay, if you see the CT scan with a lot of patches or a lot of ground glasses or a lot of fibrosis, as a homeopath, we would never touch it, because it was severe pathology of acute nature. Lung is collapsing. Any moment, patient will die. That was the fear given to the patient bystander, or someone calls up. So this was the thing was going on. If you see CT score 5, they will be admitted into the CFLT first this one. If the CT scan 7, then change into ICU. CT score 10, 11, 12, then ventilator, or the other facilities, or the oxygen was given in a high volumes. So CT score was something which they took it as 5, 6, 7. Okay, you go this side, go that side. 5, 6, 7 was creating a hangama, and it was giving me a panic. But CT scan has helped me a lot. CT scan helped me in what helped me in CT scan was the ground glass appearance of the lungs of corona, because corona has given the clear picture of ground glass, and the medicine was called was Senega. The first and the foremost medicine is Senega, bryonia, and aspidosperma. Aspidosperma, not because of we have got a video or oxygen capacity less. No. Fibrosis, crepitation, pulmonary edema, which leads to COPD and which leads to fibrosis. So oxygen capacity was getting less, acute respiratory syndrome, aspidosperma was given. Aurelia, if the patient has a cough with all these symptoms, Aurelia was added in one of few cases. Every medicine is to be given in a frequent repetition. If you tell me 10 drops every 1 hourly, half an hourly, 45 minutes to 2 hour, 4 times, everything has been tried in every possible manner. I have done it. I have given it. This is what I have done it. This has helped me in many cases. Then next is, we used to get every time we used to get SpO2 low, SpO2 this, SpO2 less from that patient. I used to give Carbovec every frequent repetition. I have even seen the cases of SpO2 70, 80. So it has come down and it has gone up. Aspida was given, vanadium was given, carbovage was given. It was in a frequent repetitions. Carbovage 1 hour repeated every 2 hourly, every 1 hourly, every half an hour. Vanadium also given in a proper way, and it has all helped me. Proudly, I can say, I don't think any 90% of the 99% cases have improved. No failures, no death has been reported in any of the cases. So this was my approach. And once the patient becomes stable, then things change. Then we reduce and take if possible, we used to get reports from the patients, or we can talk to the patient. Then the things post-COVID, and post-COVID also resolving cases, we have to change the medicines, we have to reduce the frequency. So, but all the medicines which is given is almost all these are the medicines which are given. Then symptomatic, I've been telling, if most majority of the cases, if it starts with throat complaint, then I used to go in for the phytolacca, hepasulf, throat infection was the first thing, because first signature we used to get it in the majority of the cases, which is going in a severe cases. Whenever you ask, they will tell you the first was just minor throat pain or something like that. If I get that case, phytolacca, decandra, belladonna, baptisia, and hepasulf. These are the 4 medicines which help me for the throat infection. Mercor, that also helped me, but in very small cases. These are the things which we gave it directly and frequently. And once we start this one, once they recover, they used to get all this lot of kind of mental anxieties. Mental anxieties was the worst thing which you could, sleeplessness, pulsatilla, ignatia, even cannabis indica. Cannabis indica has given me a lot of good results. Cannabis indica, pulsatilla, ignatia, and even when they start recovering it, the symptom they used to tell me as a severe back pain, a severe body pain. If they are diabetic, we used to give acid force, we used to give cesium, but acid force has helped me even if they have the body pain. If the diabetic patient had the body pain, the weakness, China tincture, acid force, sarcolactic acid, then natrum salicylicum. These are the medicines we could think, because only thing is we used to think about it as weakness after influenza. That was the main cause of we thinking about it. So it was a big risk things we used to take it. I don't think we will have to explain all the investigations. Okay. Then I will slowly go into the few of the cases which I have seen, few of the patients. I don't know whether I have asked few of the doctor. Is Binu here? Binu Jacob? Okay. I think my mother-in-law, Zeenat Harris. I can't see everyone. That's why I'm calling up the names.
Yes, she was there.
She was there or she is there? She must be there. She is one of my patient. The worst thing is, fortunately or unfortunately, my patient was my mother-in-law. So she must be here somewhere. And my mother-in-law, who's taking this, you can see the photos. She's eating food. So that was the one case which I had treasure. This was something which gave me a lot of confidence. If mother-in-law, someone from the family has been treated with, because one of the worst thing which I faced was, her name is Zeenat Harris. She's from Bangalore. My mother-in-law, she's 64 years. I think she must be here. If she is there, if you can raise the hand, I can ask her to talk, or you can, moderator can ask her to talk, what she has gone through. She took only homeopathic medicine and she's much better. She is the person who's sitting here. The worst thing is that her sister expired because of corona. Her sister's son expired of corona when she was also having corona. So that was the fear. Plus, being a son-in-law, I was between devil and we say no. There's a saying, because I cannot sit here also. I cannot go to my mother-in-law's house also. So I was sandwiched between them. My wife is next to me here.
Yes,
So
Dr. Sadhath is there.
Zenith Harris?
Yes, yes,
Mummy,
I'm there.
Mummy, can you
Ah.
explain? Please unmute. She's my mother-in-law.
Unmuted. She's
Please
unmuted.
unmute.
She's unmuted.
Yeah.
Doctor, I think you can now stop the screen sharing.
Yes.
That will be better.
Stop to share. I think she can see. Mommy, 1 minute. Can you tell me about she's
Madam,
still...
please unmute.
Unmute.
Okay. You're unmuted. You can speak.
Yes.
Mommy,
Ah,
talk.
choose one. Choose Sadhath. Koro chono.
What you wanted to tell me about your COVID
No,
experience?
I was very sick. I was very
serious.
I was very serious and was about to be hospitalized. Then I called up my son-in-law, Dr. Sadhath, and he told me to wait for another day and then get admitted. So he'll be sending me some medicines. So after taking his medicine, I was better. I was not able to breathe also. And I felt after hearing my sister's and my nephew's death, I was more serious after hearing that. Then after taking Sadhath's medicine, I became all right. And I was not admitted in the hospital. And I took his medicine. My daughter-in-laws, 2 of my daughter-in-laws also were with COVID only. And they all started taking the Sadhath's medicine. And Alhamdulillah, now by the grace of God, all are better and all are at home. No one got admitted in the hospital. So I'm very thankful to God and Dr. Sadhath also. Anything else you want to hear?
No, I think
Hello?
I can share the screen.
Thank you, Madam Seenath, for sharing your experience. That's the great inspiration for us. Thank you.
No, after hearing my, after my treatment, when my relatives all heard about Sadhath's medicine, they all started with his medicine and all, by Alhamdulillah, all were better and were very happy with Sadhath's medicine.
Great. Thank you.
Thank you.
Okay. This is another first case. I will just explain it in very faster. Mariama 73. This was one of the riskiest cases. This case was with the mitral wall prolapse, mitral regurgitation. They wanted to replace the valve. It was admitted in the hospital, so couldn't do anything. 1 month it was she was in the hospital, brought back saying that nothing can be done. Then her son called me up and asked me what anything can be done. I said we will see. And I started with the lorocerosis and other bryonia and other medicines, but it was just giving some relief for 2 days. Then again she stopped medicine. Alicia, attend karta beta. She started stopping the medicines and went back again to the problem. Then I asked her son, I asked her whether they have done any CT scan or anything at home, in the hospital. They said, okay, we have taken a CT scan. I said, they send them. Then I just saw that one line, ground glass appearance. And when I inquired them, they said after 3 days, they said, okay, they have got she had a long time back, she had a loss of smell. And ground glass and loss of smell, I thought post-COVID, and she has been in the pleurisy and pericarditis with urinary infections, with her mitral valve prolapse. And this case was given bryonia, senega, then lobelia. This was a case given lobelia and Today also she called me, and her habit is once she is little better, she'll stop the medicine. Then son calls me up panically. Yesterday also, 2 days back also, everything was okay. She was no COVID, nothing. Everything was perfect. She stopped medicine. Then went back again. Then after that, we started lobelia and urinary infection. She had all the medicines back again. Now she is better. She called me today. So all this is happening. And this is Shema, age 72. Her problem was obesity, 120 kg, diabetic. Then her D-dimer was 1170. She was reluctant on keeping oxygen. She never kept oxygen. She never wanted to keep oxygen. She used to throw oxygen every 5 minutes off. Severe. Her CT score was 14. CT score was 14. Obesity, and moreover, the problem was she had a partial renectomy, left partial renectomy 2 years back. So all the complication was there in that lady. It was a real terror to take her case, because her son was a corona warrior or corona frontline patient. He used to see 100 people dying in front of him. He used to take everything. This one. So he never wanted her mother to be kept in the house and taking homeopathy. He didn't want her to be taken homeopathy. And what happens was, she was an ardent homeopath and a homeopathic believer. She said, you have taken all the dead bodies from the from the hospital. Now you take mine from my house. So that was the belief, and that was the faith she gave it to me. That was something which was amazing, which I never expected. And hats off to her. She was 100% better. No complaints, nothing. Physician used to come and see her in the house. Bangalore had that kind of a facility. All the physicians used to come and to see because her son was a corona warrior. And this Lily was another from Thrissur. Her D-dimer, she was in the hospital. Now she's okay. She is at home. Her D-dimer was 5,000, which I just told you, 5,000 to 3,000 with just phosphorus in 1 day. That was my junior's grandmother. Hospital people just left it. They said they can't do anything now, but she recovered and she's at home now. Everything is fine with her. And Nas 27, this was one case which she was 6 months pregnant. The pregnancy or her health was not the issue. Pregnancy was my problem. Her anxiety level was whether anything will happen to her and kid. I also didn't have the answer, because the researchers which I got to it was saying that there was something happening that is happening with the pregnant. No proper research or proper answer for that to be given. So what I don't know, I took the risk. I said nothing will happen. You trust me. And she took the medicine and she is better. And after that we did a we did a ultrasound. Baby is fine. Everything is fine. The Zainulabdin 74, he was diabetic and he was under steroid. He was given steroid before my medicines. So I had to stop one by one steroids. His 74 years with all the CT score was 16. And last he developed pancreatitis and he had to be taken to the hospital because I couldn't do anything sitting here. But his COVID was negative. When he went to the hospital, COVID was negative. Post this one was better. He was only treated for the pancreatitis. And he is better. And for the pancreatitis, now he is taking our medicines. Rajesh 31, he was discharged from Thrissur Medical College, went back home. Then again taken back, discharged. The next day he has been taken back again with the pneumonia. He was a diabetic patient with pneumonia with a CT score about 13, second time. First time he had a pneumonia, so recovered and came back. Second time, they also told nothing can be done. But our medicine was arranged from another doctor in Thrissur, but it was 1.5 hours from here. Now that boy is just 31, he's at home. Abdul 2, he was another patient of my infertility kid. He was born because of our medicines. 1.5 medicines, PCOD and sperm count increased. And this boy can be told is a homeopathic boy. He developed corona, and the first thing I've been treating was Abdul with 2 years. Age was the problem because he's a very precious baby. He was born after 10 years. So very precious baby for the family. So that was it. This person, 42, was in ICU with a ventilator. Gave all this and came out of the ventilator with only of these medicines. They were, I should thank the ICU people. They supported us also because they were helpless. They said, nothing can be given. You can give whatever you want. We will support you. That way, we got the support from them also. So we should thank all the allopathic side also. I'm not against anyone, because without their support also, we couldn't do anything most of the time. They used to give me feedback also. Even in the cases of Zenith Hares and Chama, I used to get feedback from the physicians. Coming home and checking out, Shama was been seen by the physician at home. Rahmat was another complicated case because of her age, 91 one. Nothing, 90% of the cases was treated, except Lily. Everyone was treated at home with oxygen, without oxygen. But one thing we should understand as a homeopaths, we should develop our infrastructure. None of the people, or including me, doesn't have an IP facility, one bedded clinic or anything. Even government didn't support us. We did it because of, I don't know, Almighty has helped me. Almighty wanted to take risk. And moreover, I wanted to prove that homeopathy is not a bogus or not filthy system which cannot be treating COVID, which cannot do anything in such cases. At least such a severe cases, something can be done. We could do much better if we had some facilities or something which we wanted it. We could have faced it, we could have reduced it, we have done it. This is few of the cases. There are another cases also, a lot of cases also. I've just added a few of the cases which I found this is more severe and severest forms of cases. Lot of other cases, most of the time anxiety, and later once it goes and then it becomes a fun. Oh, D dimer for 5,000 when I touched, okay. Now any D dimer, anything can be done. So this is something which I just went on faster so that my time is 9:15. I took almost 3 minutes more. And these are the patient. This is Lily, her X-ray on 9/7. Now I didn't get it because they had sent it for the insurance. Okay. So that is why I didn't get the follow-up X-ray that is coming. We have the history of evidence for the 5,000 D dimer and 3,000 D dimers. We are talking with the anti-TAT and anti-mass. That was a medicine which I forgot. This has helped me like anything. This is also one of the best medicine which we have got it. Spongia has helped me in few cases. Drosera cough was a night cough. Once in the post-COVID or resolving time, most of the cases, Drosera tincture. I don't know whether you will believe it or no. I have given Drosera tincture every 2 hourly, every 1 hourly, 15 minutes also in few of the cases. Severe cough with fibrosis of the case, Drosera tincture was given. I don't know, it was against the writing of the Boric or Metria Medica. No idea, but it has helped me. I'm not talking because of Drosera. I think I have given small descriptions about the this one. Pulsatla also helped me. Spongia is another medicine which has helped me in this. Ipecac also helped me. That is, if you take the statistics, Ipecac might have helped me in 10 cases of severe cases. Senega is one of the medicine which has helped me, which has done it. And the best thing is, first 2 days, instead of Senega, the company person or the medical store sent Senna for my mother-in-law. I told them Senega. I even messaged Senega. They gave Senna. So that was when I came to know it was Senna after 2 days, 3 days. I was not expecting that. I was not finding that kind of an improvement. I just checked. I asked them to send me the photos of the medicine you're giving it. I saw the Senna and I just fired them. What are you doing? Send Senega. Then I had to explain it to my brother-in-law. Both are the same medicines. You give this medicine Senega. Somehow you have to manipulate. So that was the one thing which antimony, arsenic, belladonna in few cases. Belladonna was given for the headache. Headache with severe headache cases, belladonna was given. Kali bike was another one which has this one. Lorocirrhosis one case, and for the first one. Rustox was given, that too in higher potency, frequently repeated. I think, yes. Can I stop sharing the screen?
Yeah. Thank you.
So now
I think it's a discussion time.
Yeah, some participants already raised their hands. So let me call one by one.
Ayan.
Dr. Ganesh.
Ayan. Alicia, voice is not there, beta.
Dr. Danish.
Good evening, all. It's a very good presentation, Dr. Sadhath Sait. You have done justice in all respects. The content was full of matters, and you have shown that it is just like an international performance, and you have achieved everything in this platform. And I have no words to congrats. You have done justice, and this is the only thing I want to say at this juncture, because time is very, very short. Thank you for inviting me for this session.
Thank you, Dr. Danish. Now, Dr. T.N. Sridhara Kurup.
Dr. Sadhath Sait, you are another Sait sir to be.
Oh, no, sir.
To be become. Let us hope that you may become one of the first and best doctor in Kerala. So that your presentation was extremely good. Keep it up. I appreciate you wholeheartedly. Thank you very much. Because the time is so short, let the others may also only 7 minutes. I am not going to ask any questions. Okay.
Okay, sir. Thank you, sir.
Thank you, sir. And now, Dr. Manoj, please.
Very nice presentation, Doctor. Congratulations for your attempts. And you are very brave enough to take the risk and took a lot of cases. A very good attitude done by homeopathy physicians. Well done. Then I think we can use more potentized medicines in these cases. In Bryonia, stocks, arsenic, or phosphorus is more reduces than the syringes. Anyway, very good presentations. Congratulations. Thank you.
Thank you, sir.
Thank you, Dr. Manoj. And
Logamani Gupta is
raised hand.
Dr. Logamani Gupta.
Dr. Logamani Gupta.
Thanks a lot, sir. Thanks a lot. A very good presentation by Dr. Sadhath Sait on the most common feature, COVID-19. Everyone in the world is having a deep eagle eye for the treatment of this COVID-19, and you did a good. And the main theme perhaps you had in your mind was to cure the sick, to treat the patient. The first mission of homeopathy as aphorism 1. Very good guidance. Please keep it on.
Thank you, sir.
Thank you. Now, Dr. Rinku Sabra.
Yeah, hi, doctor.
Hi.
I'm being his patient for quite some time. Being a homeopath, I was not so much confident about my own treatment. So my husband got COVID 10 days after he took the first vaccine dose, and he had so much of anxiety and all. And then he told, you call your doctor for giving the medicine. So I called him up, and he told that you give these medicine. He gave Seneca, Bryonia, phosphorus to my husband, and his anxiety and all, it went off. He was so anxious. Anything, he was not even after he got treated from this COVID, he was not even mingling with the kids. He was so scared that if my kids can get infected with this. But thanks to his medication, only my husband got COVID, but none of us were infected. Though during his symptoms, we were with him only for 5 days. But neither me, my youngest daughter, she's just 5 years old, even she didn't get this problem. And I, being a diabetic, I'm more prone to this infection, but I also didn't get. So thanks to him. Thanks a lot.
Thank you, Ria.
Thank you. And now Ashoganan. Ashogan.
Sorry, you have to connect your audio.
Shogan's audio is not connected. You have to connect your audio and come back.
Since his audio is not connected, I believe that he could not hear what we are talking also. So I guess it might be a misunderstanding and a mistake, so that we can avoid him.
Okay. So I think no other participants raise their hands. So now I'm inviting Dr. Manoj for vote of thanks. Dr. Manoj, please.
Thank you, Dr. Ajani, for giving me an opportunity to say a lot of thanks to this splendid program. It's a very wonderful program, well organized, well coordinated, and well compiled one. We are very proud of you, Doctor, for your attempts in tackling the COVID cases and presenting before this platform. It's a very good intention, a nice method of treatment. Congratulations, and on behalf of IFPH, I am expressing my sincere thanks for the presentations and all those who participate in discussion as well as the program. And I will all of you to continue your participation on a regular basis. Thank you once again. Thank you.
Thank you, Dr. Manoj, and thank you, Dr. Sadhath, for your wonderful presentation. And please share your phone number to the chat box. So, Dr. Sadhath Sait, can you hear me?
Yeah, I can hear you.
Please share your phone number to the chat box. So.
Thank you, Dr. Sadhath, for your nice presentation. And it was a great inspiration for our audience, those who are doubting homeopathy in connection with the prevention and treatment of COVID-19. This is a great inspiration. You enriched our international audience. I hope this your presentation will become an inspiration to the homeopathic doctors around the world, and this will go inspiring in many countries and future consultations and confidence giving measure. Thank you for your presentation again.
Thank you, sir.
So we have 1 more minute left, so I think we can hand over the session to our next presentation in our Malayalam session. Over to the moderator for the next session. We are 1 minute ahead of our time. Thank you.